what are the common misconceptions professionals and families have about non speaking individuals?
Well, number one, which we just talked about, is that they have an intellectual disability and they can't learn and they can't understand. And so, therefore, we talk about them in front of them, and it's not typically always good, right? And that's one of the things that for parents, I think is, and I understand this, gosh, when I'm working with families and they realize that their kids are actually understanding and hearing and they kind of go, oh, right? Because it brings back certain thoughts, certain things that may have been said, etc. And it's same thing with professionals. Like I just think about teachers, talking about these students in front of them and not thinking that they're going to understand. And they do understand. And that's, just respect the individual, even if you aren't sure.
Welcome. Hi there. I'm Lisa Ackerman, your host today for Taka Moving Autism Forward. We have another great session for you today. Super grateful to my friend to be on this, Dr. Dana Johnson. We are going to talk about presuming competence and communication options for non speaking individuals on the spectrum. And there's so much to this in the complexity of what each individual needs. My son, I've 26 years experience navigating the autism journey, not just with him, but over 100,000 different parents. My son's traversed the spectrum, so there was a time period from 15 months to almost 7 years where he qualified for nonverbal, minimally verbal. And we'll talk about a lot of the new technology and new ways to work with people who have the desire to communicate. And we know all it's a human right to want to communicate. And Dana, let me tell you a little bit about her. For 20 years plus, she's had the privilege of working alongside of incredible families who've taught what true resilience, patience, and hope looks like. And the two things can be true at once. Your child can struggle and make incredible progress. Here's what she also realized, that too many professionals don't know how to help these families and the individuals who are non speakers. They didn't understand complex autism, and worse, they often blame parents when progress was stalled. Seeing families feel defeated and difficult challenges, and especially knowing the real issue is no one was addressing the full picture. Her mission is to empower these families and individuals and autism professionals to see autism through a different lens, one that recognizes a whole brain body connection and promotes health, opens doors to possibilities that were once out of reach. We're so excited. Dr. Dana is going to be here. I'm just going to call you Dana going forward, if
Yes,
that's great. Great,
yes,
great.
please do.
Um, Many families have who have minimally speaking individuals or unreliable speaking and non-speaking. One of their biggest concerns, we know, is parents to understand what their child knows and thinks and find a way to be able to share that with the world. So thank you for joining us today, Dana.
Thank you, Lisa. I'm really excited to be here.
Oh, great. And we're very excited to share with parents how they can untap these potentials. So it all starts about presuming competence. And can you talk about what that means and how families can look at understanding that term?
Yes. Now, I think what's exciting is that this term is becoming more popular, so to speak, and families are becoming more aware of it and hear it a lot more often, which is wonderful. I think that the challenge is that it isn't defined as, being realistic. And what I mean by that is parents who I work with are have been told at one point or another, if your child is non-speaking, they have an intellectual disability, they have receptive language challenges, all of those things. Essentially, that they are not able to understand age appropriate content. And so presuming competence is the opposite of that. Presuming competence is believing that your child has the ability to understand, they want to learn, and they can learn. And what presuming competence isn't, and I follow up with this often, is that presuming competence isn't presuming knowledge, meaning that your child knows everything. I don't pretend to presume knowledge in anyone, actually. We all have the capacity to learn and want to learn,
Right.
and so do our non-speaking and unreliably, minimally speaking kids. And I just think that myself as a professional, I was not taught this in any of my academic career. It was something
Wow.
where, along with autism, came the diagnosis of intellectual disability, and that they would only function, or they have the capacity, or they are functioning at, fill in the blank. And what I've learned over the last 10 or so years is that that is not true. It is not true. So I think understanding first that presuming competence is presuming that your child can learn, just like your teachers presumed you could going into the classroom. You didn't have to prove that you understood or could learn, yet that's
Sorry.
what our
I'm
kids have to
laughing.
do,
I'm
right? That's
laughing.
what,
It's
yeah.
like the worst. Sorry, go
Yeah.
ahead.
Yeah, no, that's it. In my experience, what I've really learned to do, and I have a number of some ridiculous analogies, but effective to help us understand, what some of those things are that you may not realize in your kids. And your kids have this capacity to do just that. They're listening, they're understanding, even though they don't look like they are. And I think we've put together what listening should look like. And when you're listening, that's then when you're learning. And what I've learned is that people listen in a variety of ways. It's not the sitting up tall, eyes on me, not talking. I work with a number of clients where they're looping or have scripting or echolalic, and they're listening to me still. It's amazing. I can't do that. That's not what I'm very focused and have to be, but that's true for them. And I want to say from the beginning too, is that do I think, because this is a question that I get a lot, and it's, do you think that every single non-speaker is able to learn and understand at age appropriate? In other words, do I think that there are individuals out there who have cognitive disabilities? Yes, of course. The general population, I mean, we apply it to very similar to the general population. I do not believe that every single non-speaker who has been told that they have an intellectual disability actually has an intellectual disability. I do not believe that. So it's this shift, and it's this really big jump for some people, the mind shift of, okay, they are listening, they are understanding, and they can learn.
I love it. I love it. I'm grateful for you to frame it in a way where parents can tackle that and
Mhm,
understand it. And
mhm.
and I know firsthand, Jeff was diagnosed with an intellectual disability back then, mental retardation, 6 times.
Yeah,
And it was all because the testing instruments were requiring a verbal response. And
right.
at the time, he was pre-verbal.
Yes,
And, I always, I'm sorry, I'm going to make a terrible joke. Who's mentally retarded? The individual or the assessor? In that case, it would have been the assessors.
yeah, yeah, it's true.
Sorry.
It's true. And Lisa, I'm glad you brought it up because, in those instances, those assessments required, him to speak,
Right.
right? But every assessment, and I'll say this to all the parents out there, every single assessment that your child has to do requires intentional motor skills. So they
Right.
have to speak, which is 100% motor, right? They have to point, which is a motor skill. They have to write, which is a motor skill. So all of these things, and yet we don't understand and realize that their disability is heavily impacted by their motor planning disability. And I know we're going to get into this, but
Yes.
that is where that, I think, gap is in the education, certainly of professionals, but then also therefore to parents, because if the professionals don't know, then the parents aren't going to know. And that's the key, really, is to really understand that motor planning disability.
Oh, great. I can't wait to get into that because that's important. But I kind of want to start in a more baseline place. What are the common misconceptions professionals and families have about non speaking individuals?
Well, number one, which we just talked about, is that they have an intellectual disability and they can't learn and they can't understand. And so, therefore, we talk about them in front of them, and it's not typically always good, right? And that's one of the things that for parents, I think is, and I understand this, gosh, when I'm working with families and they realize that their kids are actually understanding and hearing and they kind of go, oh, right? Because it brings back certain thoughts, certain things that may have been said, etc. And it's same thing with professionals. Like I just think about teachers, talking about these students in front of them and not thinking that they're going to understand. And they do understand. And that's, respecting, just respect the individual, even if you aren't sure, right? If they do understand. So that I would say is number one, is that they don't think that they can understand or they're listening because they don't look like they're listening. Number two is really not understand when I say not understanding, it's nobody's fault. I don't want to feel like that there's anybody at blame here, but that piece about motor planning, when your child does something or doesn't do something when they're asked, that doesn't mean, again, that they don't understand or they don't want to. But we take what we're seeing the individual do or not do, and then typically put it into a behavioral category, like they are non-compliant, right? Or they're trying to escape. And most of the time it's negative. That's usually what we look at. So I think that those are the top two pieces. The other one that I would probably mention is those with unreliable speech, that may be able to come up and say something, but it's not conversational per se. One, most people think that they're intellectually, disabled. The other thing is that they believe that their speech is actually what they want to say. And a lot of the times it's not. And so the individual gets frustrated because it's like something's coming out of my mouth, but it's not really what I want to say. So those would be probably the top three that I can think about as far as, the misconceptions that I see.
And it just, again, to interject, and I'm not going to do this all the time, but a pro tip if you are going to an appointment, whether it's with someone like Dana or a doctor or any clinician, parents bring in your kid's iPad with headphones or bring a caregiver that can take the child for a walk, like a babysitter, a friend, an aunt, uncle, whatever. When you're having that blatant, honest conversation on challenges, which you should have with every
Mhm,
clinician,
mhm,
but if you know you're going to talk any words of negativity about your child, it's just better, even as an adult, to headphones and an iPad and have them be busy, happy, self contained before you share some of that. Because it's really interesting how much my son heard. When
yeah,
he was nonverbal, and I'm laughing at myself, him very guilty of
yeah,
doing
yeah,
exactly what you described. And it's because we're finally in front of someone we think who can help, so we have to back up the
right,
dump truck
right,
of all of the stuff on the back that
right.
may not be positive. But
Yeah.
I encourage families to continue to share, just try to find a path to do it.
And can I add to that, Lisa?
Yes,
Just as
yes,
okay. So um just take note, this is my experience. Again, is it every,
yes,
individual with complex autism?
right.
No, but I want parents to know this too. iPad with headphones, even though they have headphones on and they're listening to something, they can still hear. Again, so here's the thing. This is what I would do because again, not everybody has the ability to bring another caregiver to
Yes,
take them out, right? So
yeah.
let's do this because this is presuming competence with your child. Before you go to the appointment, tell them just like you would your any if you have other children, okay, you know what, the doctor and I may have to have some difficult conversations because I need to learn as a parent how to best support you and maybe your tummy troubles, or so we're going to talk about things that might be a little personal, but that's only to help me. And so you can say that on the way. And then when you're there, you can say, you know what? Why don't you go for a walk with so and so? Or why don't you listen to your iPad and your music? Now, remember how we talked about this? Now, the doctor and I are going to have a conversation that might be a little personal. I'm sorry, it's going to maybe make you feel embarrassed or uncomfortable, but it's important. That is then presuming competence. And you know what? Like, let's say a parent says, "Oh, I don't think that they understand." Okay, that's fine, but what if they do? Now you've covered everything, right?
Right,
Now
right,
it's like,
right,
okay, because if you don't, it's worse. It's worse, and they're sitting there going, "Oh my gosh." Like, so that's what I say to parents a lot in situations like that. So, yeah, I mean, just have it seems strange at first because your child doesn't respond to you. But
right,
when we can start to just have conversations and not ask questions, because that's the other thing we tend to do, right? It's automatic for us. How are you doing today? What did you
hmm,
do yesterday? How was school today? You know, like all these things. And instead, it's more statements, right? Start practicing just making statements and observations. Did you see on the way to the doctor's office that there was this really big cow that was right on the edge? And you know, like, and you're just pointing things out.
right.
It's then it gets easier as you practice because it is a little strange at first, but that's where, you know, we start pelting with questions and then we feel bad. It's like, ugh. Or we don't talk at all, which, you know, sometimes that's okay too. But in
Oh,
this, that's just a suggestion that I give parents very frequently in terms
oh.
of conversations like that.
God, I love it. Thank you for adding to that. That it's
Yeah.
just such a great reminder for families, different strategies. I even had one family just slide a piece of paper across the desk saying
Yes.
all of the things
Yes.
that she did not want to verbally articulate in front of her individual who
That's
she was
great.
presuming competence, but
Yes,
just
that is great.
sliding it across it. So there's your three tips to help. So shifting gears, what have you learned from non-speaking individuals themselves about being misunderstood?
Oh goodness, how long do you have, Lisa? Gosh. Um, Honestly, I credit everything that I do now pretty much to my clients and their families.
Oh,
Because I, you know, have a master's in occupational therapy. And so that was, you know, that's my
mm-hmm,
clinical training. And then my PhD is more in family systems, mental health and development, and child development, and all the things. And it was not until I started working with this population and the families that I work with that I truly, truly learned. And they teach me new things every single day. You know, I am a fierce advocate for parents specifically because I have learned over the years just how hard you all, because I put you in that category, Lisa, have worked to fight for your children,
right.
and yet you're still gaslit. You're still told, oh, it's just autism, all the things. And so I take everything that I hear from parents, that I learn from parents, and
Mm-hmm,
apply it to what I have learned. So, I mean, for me, the specifically with non-speakers and my clients is that what you see on the outside, what my body is doing, isn't necessarily, in fact, it's more often than not, not what I want to do. And, you know, it's very, very tricky. It's very tricky because I always say this to parents too. I had a client in yesterday and he was just turning 13. And, you know, I could just tell that he had this like little attitude. And I'm like, this is great, you know, because he's 13. He's trying to. So I turned to mom and I said, you know, this could be whole body apraxia and he's struggling to, you know, figure all this out with his body
mm-hmm,
and get it organized. Or it could be that he's like, nope, I don't want to do this, you know, which is both could be true. Both could be true. And so I think that I love that I get to do this and I am blessed every day to be able to do this,
mm-hmm.
what I do. And so I think I take every single second and learn as much as I can from my clients because I do. I learn everything anew every day, and just my mind is blown with their abilities and what they can do when I was one. most therapists, physicians, professionals in the field were not taught this at all. We're taught the exact opposite.
Right, right. So let's get into some of the fun stuff you kind of touched on earlier. What are the neurological or motor challenges that may prevent someone from expressing what they know?
Yeah. It is purely, this is me, my opinion over the last number of years is that
Hmm.
part of autism is a neuromotor disability. And, there's a lot of other things that are wrapped up in that, which I know that you all are so great at educating families on with specifically the medical complications.
Right,
And I think that that is something that, neurologically, I don't want to get too much into all of that, but the brain really does struggle with that regulation. The part of the brain that helps support our sensory processing and really
right,
filters the incoming sensory information is it struggles. And that part of the brain is called the thalamus, and it struggles to kind of filter, and our brain gets overloaded, or their brain gets overloaded with information. And then what happens is that motor output and that regulation is just off. And so you see impulsivity, and you see fast movements, or you see them not be able to move at all. And so I think that, yes, I was taught as an OT about the sensory processing and how they have difficulties with sensory processing, but I was not taught about the fact that there are disruptions in the connections between those deep level areas of the brain and the rest of the body.
right,
They go offline. And so I think that that piece of it is a huge key to, number one, and probably most importantly, how to support these individuals. And then number two, how it adds to the picture, and completes the picture of the whole child, right? Because it's not just one thing. There's multiple things that could be going on in each individual child. And so I think that with that understanding, it really does empower parents to then really understand what their child needs. Because on the
right,
outside, it just looks like behavior. It just looks
right,
like behavior,
right.
and it's not.
And so behaviors are an important clue, but it's their communication in itself. We've talked about that before. So
Yeah.
care to comment on that?
Yeah, yeah. And I was one that would say, behavior is communication, behavior is communication. And I challenge that in a lot of ways. And the reason why I challenge that is because of that disconnect, that I have the ability to um think about what I want to do. I have the intention of what I want to do, but I can't get my body to move. And so that looks like non-compliance, right?
Right,
And so then they're in their bodies going, no, I really want to do this, but I can't initiate my body to do it. And so this is where this misunderstanding comes. So I I have a caveat on behavior as communication, because it's not always communication. It's not always telling us something, or it's telling us something that we're actually misinterpreting. So an example would be, I have clients that might be self-injurious, right? And or injurious towards others. And that doesn't mean necessarily, and I say this because my clients have told me this, where it isn't that I'm frustrated, it's actually that I'm excited. And I'm like, that's not what I would have guessed from this, right? So that's,
right,
I
right,
mean, multiple examples of that. And
right.
so, again, is it all the time and they're always excited and they're always happy, but
No,
yet they bite their hands? No, 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 no,
no,
no. Really, that impulsivity, that self-injurious um, behavior is impulsive, and that is triggered by emotions and sensory input. That's how that happens. And so the emotion could be frustration, or I'm mad, or I'm angry, or it could be I am so excited and happy, and yet it looks the same. And so it's more complex, unfortunately, than
yeah.
just that cut and dry. So behavior isn't always communication, and it's not always what it looks like.
All right. So before we get into the communication options,
Yes.
one more question. What are some of the signs an individual may understand more than they're able to demonstrate or communicate?
Oh, that happens all the time. And I'll point it out to parents. And here's typically what happens, Lisa, is like I will point out something like some kind of like like are you like manipulating me right now? Like those kinds of things or like a problem solving thing, right? Like, oh, last
Hmm.
time, here's an example.
Right.
Last time Dana had this on the table. It's not there anymore. Where is it? I'm gonna go and try and find is somewhere here. Like, I'm sorry, but that takes a lot of cognitive ability to do that. So I'm just like, I get, and I point that out to parents. I'm like, and your child, you were told that there's, I'm like, do you see what's happening right now? Right. And I know that there are a lot of parents can,
Right.
see that. And
Uh-huh.
that's where when parents come and see me and I'm explaining everything to them, that's when they usually say, I knew he was in there. I knew he was. But the problem is that everybody else is telling me he's not. So I've then forced myself to believe, not hope anymore,
Right.
not I've shut all that down because they're the professionals, they're the experts, and this is either what they said to me or this is what they're doing. So the
Right.
speech therapist, the OT, they're doing farm animals and he's, 13, 14. And I'm like, yeah, right. So I think that's something that I encourage parents. I'm like, you have to go with your gut. You have to go with your gut because I can't like the stories, right? Like I walked in and there was like letter blocks and there was a word and I knew that they saw that word yesterday on the show that they watched. And so I'm like, oh, maybe it was a fluke. I'm like, no, it's not. It's not. So it's these kinds of things that I hear from parents and I also observe in my sessions.
Oh boy.
Yeah.
Jeff, when he was pre-verbal, he was the master manipulator.
Right?
The master could get any architecture to any situation. So I smile knowing that they are in there, and I appreciate that. So
Mhm.
let's pivot to communication options. What should families know about options today for communicating when a child may be minimally verbal or nonverbal, pre-verbal, or
Yeah.
non-speaking? Let's pick a term.
Yeah. Yeah. Any and all. There's a lot of options. And the first thing I say to parents, it doesn't matter what they come in, and work with me on. I'm like, I'm never going to say to a parent, no matter what method they're using, to stop,
Right,
because we're all multimodal communicators. I
right,
text, I email, I talk, so I can't, I would never say that. What I do say is that every single form of communication is a motor skill, and so, we could be, giving a glare at somebody. That's a motor
hmm,
skill, right? Like we communicate very, very well. And every single form is I need to intentionally move my body. And that's the
right,
struggle with our non-speakers, unreliable speakers, and is that they don't have the motor ability. And in fact, nobody has taught them the motor skills to use most of the devices out there.
right,
So it's like, and I know some people are gonna be like, yeah, well, my speech therapist, she has practiced things over and over again, like I want more, or bathroom, or and I understand that, but then what happens is whatever you practice becomes
right,
permanent. So now we're saying I want more swing when I really want more something else, and we don't know if that's reliable or not. So
right.
with what I do as far as using letterboards to teach the motor skills, that's the start of it is, and I say this to every single parent because I get parents coming in from all different backgrounds. Most of them are very well informed. They've read the positives, they've read the criticisms of it, everything in between. And I say at the very beginning, what I want you to keep in mind throughout the entire session is that I'm teaching your son or daughter a motor skill. I'm not quizzing them. I'm not teaching them how to spell. I'm teaching them a motor skill as if you hired a tennis pro and you're getting a tennis lesson. they're going to prompt you. They're going to move your hands so that you're
Right.
gripping the tennis racket correctly. They might even move your stance so that
Right.
you can be
Right.
in the position. And yet, if you miss that ball, they're not going to say, cognitive disability, right?
What
They're
a
going to go,
great, what a great
oh,
analogy.
it's like, oops, you moved your head too quickly, which is a motor
Hmm.
skill issue, and you lost track of the ball, right? So that's what I'm doing. I'm teaching your son or daughter a motor skill. I'm not teaching them how to. So there is like prompting. I'm even touching their hand to get them to poke and then come back, because how often do you touch something repeatedly in a intentional way, right?
Right.
It's all these new skills that they need to really practice and practice and practice. And so that's what I'm doing. The expectation isn't that I'm going to sit down and they're going to tell me all their thoughts on day one. Never happens. It's like, so
So I'll
always
send you my
start.
magic fairy wand. It works really well.
Well, I need one then, please, because if that's the case and it's that easy, Lisa, you need to sell those.
Just kidding.
Yeah.
Oh my
Yeah.
goodness.
So
Oh my
so
goodness.
that's and the difference, right, is that
Right.
with AAC, any of those devices, PECs, sign is a little bit different when you talk about that. It still requires motor skills and
Right.
still requires a lot of motor skills. Is the AAC devices are limited, of course,
Right.
on what is on the device. And because we go back to, well, my child has an intellectual disability, so I can only have six things on at one time. It limits them. It's not necessarily what they want. It's what is accessible or what, the SLP or the teacher or the parent want. And it's always starts out as requesting and very limited research on it being a device of communication, meaning conversation. Whereas, spelling and typing, that's what my clients do, is that they get to that point of, I'm now having a conversation. Now I'm writing a research paper in college. Now I'm writing a blog. Like, they get to that point, but it's because of their motor skill practice. So
Right.
when I say, like, okay, we're back to the tennis example, day one, you're picking up the racket. 2 weeks later, you don't go to the US Open, right? Like, that's not going to happen. That's,
Right.
people would like, are you, of course. Well, that's the same thing with what I'm doing. You're not just going to go and start having this open conversation on a keyboard
Right.
2 weeks later. So it takes years. Some of my clients, it takes years, and it
Yeah.
depends on their motor profile.
I remember back in the day, again, Jeff Solder, PEX, the Picture Exchange Communication System.
Hmm.
He was flipping through his book, which became very big. It had 10 pages front and back with the different words. And he flipped through again, couldn't find the word, came over and touched my face. And you have no idea. I started crying. It's like
Yes.
we lost the word he wanted.
Yes.
And now I have no idea.
Right.
They need the options. They need, and you mentioned, you touched briefly on ACC, or AAC, excuse me,
Hmm.
augmentative and alternative communications. I need to even define it for myself. How do these, what are they, and how do these fit into the communication journey?
Yeah. Well, typically, AAC devices, and again, this is the area of expertise of a speech and language pathologist.
Right.
So I know it just based on my clients and having worked
Hmm.
with some. But really, that's if a child is, working on speech early
Right.
on, like if they're delayed in their speech, they'll go to speech therapy, and the speech therapist will work on those motor skills to try and get the mouth moving, right? And to formulate some words to try and progress. Now, there comes a point where that would be up to the speech therapist to say, okay, based on what I'm seeing, let's investigate using an AAC device, which
Right.
typically is an iPad with an app on it now. When I was first starting, it was this big, heavy Dynavox things, and
Had one
they
of
were
those too.
right. They're massive, heavy, and like, here, kid, carry this around, right? Like, you're like, wow. So now, thank goodness, technology is much more advanced. But that's usually what my
Right.
clients come in using. And there's Proloquo, there's LAMP, there's touch chat, there's a number of different, actual apps that are out there. But the premise is pretty much the same with them.
Right.
The one program that I do like for if it's a requesting, because for me, my clients are spelling out everything, right? Yes, it takes time,
Right.
which is
Right.
fine. But if you can have a device that says, like, "Oh, I need to go to the bathroom," then let's push it and then let's go to the bathroom, right? Like, or, a child will sign just, using their body. But
Right.
I like LAMP for the purpose of the motor planning. It does not move, it doesn't change. Whereas pro lo quo, sometimes it's like the speech therapist, the parent, the teacher is like, you know what, let's move these around and put them here so that then we can add more. And I'm like, whoa, but the motor planning of that, like, and so, yes, I mean, there's pros and cons. And again, I'm not the expert in the area, but usually that starts fairly early. And
Right.
then
Right.
what I hear from parents, though, and same thing yesterday, I heard it again, was yes, my child, he'll use it at school, but he doesn't usually use it at home. And I'm like, that's what the research says too, actually. But part of it is that you know your child so well that they're going to
Right.
just go get it. You're going to get it for them, or they're going to care, like, so it's, there's pros to it, there's challenges with it, etc. But like I said, I'm never going to say stop using a communication device ever. Yeah.
Excellent. And for parents listening to this for the first time, lots of show notes, lots of links that we'll
Yes.
be referring to. There's no quiz later.
Yeah.
Let's keep diving into this. How do you determine what approach may be the most appropriate for each individual?
hmm So 100% of my clients come in with what is called, I mean, most of them are non-speaking on the
Hmm.
spectrum. Some are not. Some have Down syndrome, other developmental disabilities, some genetic syndromes. But what they all share is what's called whole body apraxia. We've kind of been talking a little bit about it throughout, but it is the motor planning breakdown of being able to sequence and organize your body to be able to carry out an action on demand.
Right.
So that is essentially, and probably many of your parents listening and professionals, of course, too, would know childhood apraxia of speech.
Right.
And that's common. That is a formal diagnosis given by a speech language pathologist. Most of my clients are not diagnosed with CAS or childhood apraxia of speech because they don't meet the qualifications. And I understand that. I know what the diagnosis is. And when I do have some come in, I'm like, oh, yes, you have that diagnosis.
Right.
So most of them come in, though, and their whole body is apraxic. And so that's where I term it whole body apraxia. Now, the difference with that is that that's a symptom. That is not a diagnosis. So often I get parents saying, could you diagnose my child? Could you assess and diagnose my child with whole body apraxia? I'm like, no. And here's why, is that it's a symptom of something else that's happening that is preventing that connection and that sequencing, planning, organizing, executing, following through with everything.
Right.
And that's really the breakdown that I see. So the majority of my clients struggle with that, if not all of my clients. And again, it's also a spectrum. So I would say those who have speech and are more unreliable or minimal speakers tend to be less apraxic because they have more control of their fine motor too, because speech is fine motor. Those that tend to be more dysregulated, non-speaking, have impulsivity, they're more apraxic. It takes so much for them to be able to do one thing. And so that's, with spelling, all of them fit into the category of this is something they could do, you know?
Excellent.
Um, I don't know about AAC again, what the criteria and what
Right.
speech language pathologists, but that is something that all of my clients can do. It's the practice piece that has to be there.
You bring up so many good points, and some parents may be thinking, "Oh, I'll just get my kid an iPad." But can you talk about the
Yeah.
role of technology in expanding communication options?
Yeah. I mean, when parents come in to see me for the first time and I'm explaining the whole process, they're like, "Have you not heard of technology?" Like, what- these are like plastic boards. Like, what's wrong? And then a laminated 8.5 by
Yeah,
11.
yeah,
Like,
yeah, yeah.
what
Yeah.
is going on? And I'm like, yes, I have. And
You're like, thank you
that's
so much
right.
for opening my eyes.
I didn't think about that before. Thank you. Here I am in my own little island, but
Sorry. We
no,
joke.
when I explain to them, this is about the motor skills, right?
Right,
When we're
right,
talking about really looking at the beginning stages of spelling where the
right,
entire alphabet is divided on three separate boards, the
right,
letters are large, for targets, and then you compare that to a keyboard and you're like, and I'll say, like, look at the motor demand difference here, right? Like, so we have to start where it's easier motor,
right,
going back to the first tennis lesson, and then we practice and we get to be able to make more complex,
right.
right? More like tinier motor movements. The biggest thing that I think is missed, and maybe I should have said this when you asked me the question at the beginning, but I just thought about it now, is vision.
Right.
Our vision directs our motor output. And I don't have the stat right in the top of my head, but the majority of those with autism have some kind of vision dysfunction, right? And what I'm talking, I should say, I'm not talking about acuity, meaning can they see clearly? Most of
Mm-hmm.
my clients can pick the speck of sand off my floor.
Right,
So
right.
I am
Or your
not
shirt.
right, or the shirt, the lint, everything. So it's not about clearly, it's about how is the brain processing what's coming in through the eyes. And once we can get an assessment, oh my goodness, the difference in that individual can be extraordinary in terms of
Right,
regulation. Because if you're seeing double, if you don't have depth perception, how dysregulating would that be? How think about that as far as impacting your day to day.
wow.
So that's, one area where I definitely look at, consider, talk to parents about, and then refer. But
Mm-hmm.
that's the other piece of the whole spelling process is seeing large targets and being able to have more flexibility with the fine or the motor movements, but then think about on a keyboard, right? The
Right.
ocular motor, the fine motor demands that requires. So
The
that's
level
why
of
we start.
accuracy.
Exactly. And that's why you can't like go to somebody with a keyboard and say, "How was your day at school today?" Yet that's what educational institutions typically
Right.
start with is the keyboard because they know about technology. Lisa, I don't. Sorry.
We joke, people. We
We're joking.
understand.
We're totally joking.
We
Totally.
joke. But you brought up a good point, and maybe we can elaborate. What skills are needed before going through spelling and
hmm
spellers?
hmm Zero. Like I want to see your child. That's it. Like and parents will often come in and say, "Okay, so we worked on
Right.
identifying letters. We worked on this
Oh,
before we came to see you," right? Because parents think that that's a prerequisite is letter identification. And then that's a great opportunity for me to go, "Okay, pause for a second. What did they have to do to identify those letters?" And they're like, "Well, I just had," and they go into this like explanation. I'm like, "You're right. All of that is a motor demand." And
right.
so let's teach them the motor skills first, and then we can assess whether or not they actually know their letters. But without teaching them, it's kind of setting them up for failure. And I mean, I don't typically say that to parents because I know that
No,
they're
but
coming in, you know, trying to prep because they want this to work, because this could
right.
be open up so many doors. And so, yeah, I mean, they don't need to be regulated. They don't need, I have individuals come in all ages. So my oldest I've ever seen was 56. The youngest I typically start with just because at 4, 5, 6, like your body isn't going to want to sit very long. So, that's just a typical 6-year-old.
Right.
But we still do it and we still work on some skills. But yeah, I mean, I am working with 6 to 210 pound injurious, clients that are impulsive. There's no prerequisite. We don't have to get them to be in sitting and, nice hands and eyes on me and zero. They come in with their headphones, with their iPad in hand, with their headphones connected to their iPhone, and they have these like abilities to start and stop, their videos at certain times, and each one is coordinated. And I'm like, yep, bring them all in. Let's do it. And we do it with all that stuff.
Oh, and I love that you look at the world in such a perfect way. Each individual has that ability, and I love
Yeah.
that. Thank
Yeah.
you for that. And some parents might have minds blowing right now, and this is really. Let's talk about some examples of different topics non-speaking individuals once shared once they had reliable communication. Let's blow some minds.
My favorite is when they start dropping like F-bombs and parents parents are like they're like they literally go beat red. They're like, I don't know where they would have got that.
I know where he would get it if it was
Right.
me.
So I'm like, I know, right? It's amazing. See, they're listening. See, they're listening. So that's always makes me laugh. That's hysterical. But I've had spellers and clients come in and they're like, I want to pursue my college, diploma in, whatever it is. And when they're older too, and parents are like, okay, let's do this. This wasn't what,
Aw,
financially what we had planned and, but they're going to do it. It's not even a question, but that just speaks to, parents being told that, you money as far as what you may have put towards the
right,
education has gone to
right.
something else because why would I do that? I that's understandable. But things like, pursuing post-secondary or even just getting a high school diploma, not just,
Right.
that's a big achievement,
It is.
but getting a high school diploma, many of them want to work on their impulsivity, their self-injury, or especially those that have, injury towards, a lot of moms, they're the target, unfortunately, with some of that. So they don't want to do that. And how do I help stop my body from doing that? Being able to advocate. I mean, there's so many advocates, and Lisa, you know two of them with, being on IAC with Kaden and Elizabeth, and they're
Oh my
just,
God, they're amazing.
yeah. And so many, they're two of many that are, this is what they are doing. Not all of them want to be advocates. It was something that I learned. It was like, gosh, I want to tell everybody in the world, but some don't. Some are just, this is what I want to do with my life. And I love hearing about it. I love hearing about it. So those are the things that I hear. I also hear, some of the more challenging things, like that's where trauma can come up and, more negative experiences, especially the older ones that have had some situations. And with
Mhm.
that, that's when I refer out for
Right,
therapy and working with the entire family, actually, because it's a whole family thing. And
right.
so that's something that we need more therapists that understand that can work with these families, because that's really, really it's significant. It absolutely is significant.
God, you bring up such a great point. And when they get their communication, what opens up is amazing and sad sometimes. And
Yeah,
that's okay. We want to know.
yeah.
But in the show notes, there'll be a link to the Interagency Autism Coordinating Committee meeting from April 28th of 2026, where you can see and watch two advocates that are non-speaking using alternative communication, Caden and Elizabeth, and they're my heroes. And I know you love them too, Dana. And
Mm-hmm.
just
Yeah.
if parents want to see just tremendous example, they can see that front and center. So let's shift to parents. What advice would you give to parents who are feeling a bit discouraged because all the traditional communication approaches have not been successful?
Yeah. Yeah, it's interesting, Lisa. I have shifted a lot in the recent, months, even, yeah, I would say in the last 6, 8 months, to really put a lot of focus on what I do to support parents
Great.
in their journeys, and not just with communication, because I think that in my experience working with those, families who do come and see me for that communication support,
Right.
um, I have realized that there are so many like what you just said. It's like I have tried XYZ therapy. I've tried everything, functional medicine.
Right.
I mean, we could go down the whole list and, really challenging. And I think I really try and help and support them to kind of navigate this and to, again, within my scope, meaning that if they're needing more of that therapeutic approach, counseling, professional therapy, then that is
Mm-hmm.
where I would refer out to. But ultimately, it is so much about understanding their child. And I think I was one of those therapists way back when I first started that told parents incorrect things. And unfortunately, the majority of therapists still believe what we were talking about at the
Right.
beginning with the
Right.
intellectual disability, the behavioral focused methods, not understanding regulation. And this is interesting. I was talking to an OT yesterday, and she was telling me, she's like, I don't think, after talking with you, I do not think that I understand what regulation means. And I said, probably not. I wasn't taught this in school. And it's
Right.
not just putting a kid on a swing, it's not
Right.
just giving them the input. It's not,
Right.
it is really giving them part of you as far as co regulating. And I'll tell parents and work with them and explain you are your child's most powerful regulation tool. It's not about something else to give them. And, now I also understand parents go to me, like say to me, okay, but what happens when I'm not regulated? And I'll say, yes, that's life. That is absolutely going to happen, right?
Right.
So let's talk about, how we can get more towards more co-regulating than not. And one of the things, Lisa, that I've learned, that I knew but really really learned about is that most parents are living in a state of dysregulation, anxiety, and
Yes.
stress that they actually don't know what no stress feels like. Like that is their
Yes.
norm. And so when I'm asking them to really dig deep and think about what their body's doing in a certain moment, they don't know what it's like to go back to baseline because it's been so many years. So I think that me being able to recognize that and then be able to coach families with that, has been really, really helpful. And then, of course, to help them to understand their child's individual profile so that they can then support their bodies and learn and understand behavior versus whole body apraxia and how my mindset and my beliefs are going to impact my child's progress. And so these are all things that I have learned over the years, but definitely have learned from the families that I work with. And so that is kind of my shift, next in my next life, my next, of what I'm really focusing on because it's such a need, like you said. I mean, it's
Right.
a huge need is the family piece.
And for families new to functional medicine, there'll be links in the show notes. And I can't stress it enough. It's not just for the children and the people we support, that could be adults, it's
Yes.
also for the parents.
Yes.
A little cortisol,
Yes.
ashwagandha support is a good thing. And
Yes.
Dana, how much more time do we have together today?
Yeah, let's see. We can do another maybe 10, 15 minutes, Lisa, if
Okay,
that.
I just want to
Yeah.
make sure because I
Yep.
got like 1,000 questions, but this is not going to be a one and done. I'm sure we'll be back together. But let's shift to school and educational systems.
Hmm.
It's not always the best tool for our families and their best friends. But what should parents know when discussing communication support with schools or early starts, regional centers, etc.?
Yeah, and that's really, now even more so,
Yes.
unfortunately, tricky.
Hmm.
As we're talking today, there's a lot of discussion nationally and,
Yes.
with government federal at the federal level as far as
Right.
communication support. And I know that there are some like many amazing individuals that are fighting for communication rights and communication access. For me, when I'm talking to parents, I look at it two different ways. Number one, what can parents advocate for their child in the school tomorrow, like when they leave, right?
Right.
From seeing me. Because at that point, parents are like, oh, wow, they do understand at a much higher level than what they're getting in the school system. So will talk to parents about this because I say, your teacher is doing an amazing job. They're there. They're not getting paid a lot. And to be a special ed teacher, it's in your heart for the most part. I'm not saying there's not bad apples out there, but they truly love these kids and working in this area.
Right.
So they don't have a lot of resources. They don't have a lot of extra time. So I don't want you going in and giving them a whole list and saying they need to have this curriculum. But what can they do? If your child will tolerate headphones, so this kind of goes back to your example, Lisa. If your child will tolerate headphones, I suggest, if your teacher is open to it, to allow your child to listen to age appropriate content, meaning podcasts or like I have a podcast, it's called Why, and it's like, why is the sky blue? How do clouds form? Like all these different like science-based interesting things, because and it doesn't have to be loud. Your child can listen and hear even with that, the headphones on. They're going to still hear your teacher. So a lot of teachers are open, and even if they're not, they'll be like, okay, I'll try, but let's see what happens, kind of thing.
Right.
So but that doesn't cost like that's not costing anything. It's not adding work for the teacher. So I really try to make things like, any type of suggestions very suitable for the teachers as well as the
Right.
parents. Because then I say to the parents, the one thing that every single parent I think needs to realize is that number one, your child may not be getting the academic curriculum that they deserve. However, they have friends, they have peers, and friends are really important. And so school is important. Now, if they're having increased behavioral situations at
Right.
school, then we might want to consider alternative things because they could be saying, I am bored out of my mind. I know my numbers. I don't want to match any colors or shapes anymore. I don't want to do,
Please don't read
fill in
that
the
book to me
blanks.
again.
Do not read that book to me again. Like all of these things. And so even though I bring that book to you, do not bring, don't want, that happens frequently. But the other thing is that what I've learned from my clients is that they learn things so quickly. So if your child is in elementary school, first and foremost, they're going to learn, they're going to get caught up, if you will, like, if they're worried about they're not getting age appropriate content. But the other thing is like we need to work on reliable communication
Right.
first, because
Right.
then they can demonstrate what they truly know, and that's what we need to get to. And I think I'll also say, when was the last time that a college looked at elementary school transcripts? That's the other question, right? Like never. So if your child's in elementary school, different thing, for high school, obviously. But if your child's in elementary school, let's focus on getting that reliable communication down so
Right.
then they can access their age appropriate curriculum, because that's what schools are going to require, is that they have to show what they know. But that practice needs to happen at home first. Don't expect the school to go, oh, great, I'm going to use this. I'm going to use this. I'm going to use this keyboard or
Right.
this letterboard. That isn't going to happen because, as you will soon learn, if you aren't familiar with spelling or
Hmm.
typing, there is a lot of practice and a lot of training that needs to happen. So I kind of give that spiel to parents because I think it's once they see it and they see their kids can use this as communication, then it's quick, let's get it into schools, and I'm like, ooh, slow it down because it's a process. And then I send referrals to people who are amazing advocates to help them do that.
Great. 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 And so, from a parent perspective, what can they do to better advocate for communication access
Mhm.
in the school setting IEP process, the individual education plan process?
Yeah, that's a tricky one as well. I think, like I had said early on, all forms of communication require intentional motor skills, and your child struggles with that. So I often will say to families, right now you're working on building the motor skills at home to have reliable communication through
Hmm.
that method, okay? If they use an iPad with AAC apps on it, great, keep that going. But focus as much as you can to have the OT or PT and teacher build on their motor skills. Because
Right.
when you're working on spelling, if that's what you're using, you're not just working on the spelling skills. Your brain has the ability to, generalize these things. So if you can work on building intentional motor skills throughout the day and practicing intentional motor skills throughout the day with therapies that you would have there, that is going to help with that communication
Right.
process. So that's really what I focus on, because to try and get, like I said, it's getting tricky to get certain AAC options in an IEP. So working with an advocate is going to be your best bet right now to be able to do
Right.
that.
Right. And just any thoughts on when someone in the school district says they can use it here in school, but they can't go home with them? Do you have any words of wisdom there?
Oh, wow. I don't know if I've had a parent. Usually it's
I
here's the
have.
device. Really? Okay.
Yeah,
Usually,
you
yeah.
get this here, but it stays in the classroom.
Right. Okay. So here's the duct tape over your mouth when you go home. Like, here, parent, put this on. Like, oh my goodness. And I know it's not the parent. I know it's not the parent. I
I
should say,
know, but it
what I
just,
should say is, here's the teacher. Okay. So my kid is going to leave his device here. Here's a piece of duct tape to put over your mouth until you get back tomorrow.
right,
Sorry.
right, right, right.
Again, we're joking. But I mean, that's essentially what you're doing, right?
Well, we're
Like,
sharing the red flags.
yeah, yeah. Yeah. Yeah.
Well,
I think, wow, there's a lot of choice things I could, but I won't. Just because I get, like, it floors me. Like,
yeah,
again, their understanding is that, well, we're just practicing it here, and so they don't communicate. And it goes back to the presumption of competence too,
right.
right?
It's just good for parents to hear that if you get that, just say no, that
Yeah.
device is a 24/7 right, not just,
Yes.
9 to 2:30 at school. So, all right.
Yeah.
Well, I know you have to go, and I'm just so grateful. If you could leave one message for anyone who is a non-speaking individual they love, one message today, what would you be sharing with them?
Yes. Don't give up hope that your child can communicate and can demonstrate their knowledge. They have so much more in there that they want to get out. They
Yes.
just don't have that way yet to be able to do that. And I think, for me, I absolutely love it when I have families come in and their children are older, because I just commend them, because most of them have come to the realization that this is how it's going to be. I've done everything, and I'm good. I'm content here. And yet now there's this, and everything could be ripped open again, or I could have what I've never had, but I've always wanted to have. And so when they see that their child does have this ability and
Right.
that they can, I mean, I this is probably the hardest part of my job, Lisa, is that I feel, all of that, but yet I have to remain regulated because of the client sitting there, because I am co-regulating for that client, because they're doing such an amazing job keeping their
Right.
body regulated. But then, like I said, emotions, just like for all of us, but they sense their parents' emotions immediately. And so then I'm trying to keep myself together so that they can keep, but that is, the biggest thing, because I think younger families, they're still on the journey of, okay, I'm going to try this. Like, I'm going to try this, and we're going to jump in 100%.
Right.
It's the older families that come in, and I just, like, I am sure this took a lot for you to get here, because of
Right.
where you're at.
And God bless them. And,
Yeah.
I encourage families, TACA has virtual and in-person support across the United States. Please join in. And Dana, you are a gift. I'm so grateful to call you friend, and but really appreciate how you presume competence and help every individual. And I look at communication, however it gets done, as a human right. And we're so grateful that you're here to support and to do what you do every day in, day out with spellers and with any way to reach those individuals. So thank you from the bottom of my heart, and
Oh, thanks,
look
Lisa.
forward look forward to having you come back. This is not
Yes,
going to be a one and done thing, so we'll take
great.
account into input and what have you. But thank you everyone for being part of this podcast, and know that your child's in there and that communication is a possibility and to never give up. So thank you again, Dana. Have a great day.
Thanks.